Live from the studios at KUSI News, inside San Diego.
Also, we're talking mini facelifts, lunch break fixes, and cosmetic procedures. You know they can be done over the weekend now and have you back to work by Monday. How about that?
How about that?
We're going to be learning all about that. There's a before and after from One Quick Fix. We'll tell you how you can take
Nothing
part.
wrong with that. Quick fix.
She looks better.
Nothing wrong with that.
In a weekend, they say. We'll find out all about that. From Health Minute to Quick Fixes, mini lifts and small cosmetic procedures that can be done over the weekend and have you back to work on Monday. They become all the rage.
They are. You know, I'm from that old school where people, they need a nose job. They got to wear that bandage for the next 2 weeks, and they're great. But I guess things have changed a lot.
Things have changed a lot.
To find out just how much and what kind of new things there are, we have Dr. Amir Karam here to talk a little bit about it. Thank you for joining us.
Thank you for having me.
Great to see you.
Probably the biggest thing that we're noticing nowadays with patients is they really just don't have time. You've got busy lifestyles, busy work, and even as they age, and especially in Southern California, you got so many things to do, families and activities. You don't want to spend a couple weeks outside of that healing from surgery, but yet at the same time, they want to have the rejuvenation and they want to look better. So our field has sort of, come up with a few therapies for that has really impacted the field.
Now, in the old days, if a woman went in and had a facelift, she would expect to have some hideous bandage on her face and have to stay out of view for months at a time, maybe 2 months, right?
That's right. And even that has changed a little bit, even with the classic facelift. But yet, the newer facelifts that are coming out to sort of address those issues and get people back on their feet in about 5 days.
5 days, and that's a mini facelift, and that's the first procedure that we're talking about.
Yeah, the mini facelift is basically a toned-down version of the. Oh, actually, yeah. So this is the image of a fat transfer case, which shows some changes. You see the hollowing in the underneath the eyes, underneath the rims there. You can see that. And with the fat transfer, which is also a 5-day type of a procedure. Fat is harvested from the belly or the side of the legs, and it's used to fill up the that area. You can see the top picture.
That's an amazing change.
Yeah,
really,
big change. That hollowing, it's a big problem. A lot of people have not been able to quite address it.
So this fat transfer, this woman had this maybe on a Friday, and she's able to go back to work on a Monday?
You can be pretty much back on the road after something like that in probably about 3 to 4 days, just depending on how you bruise. Now this is a patient who had a 5-day facelift, and you can see the changes along her jawline. There's some sort of drop there on the picture on the left, and some hollowness underneath her eyes. And by doing a mini lift, you can see the entire face has become recontoured, and the jawline is redefined, and the neck is a lot more.
Looks like two different people.
Right.
Yeah, it really does.
What do you do for that lift, though? I mean, obviously, it's not a full throttle facelift, so you're not going to get the result of a...
Sure. It's, I would say in a person who actually needs a full facelift, you're looking at something, more subtle than a full facelift will give you. But then there's a lot of other people who really don't need the full facelift to achieve the nice jawline or achieve the neck. And those patients, the mini lift would be the perfect solution, even if the patient was willing to take on a longer recovery time.
I see a lot of people who have bags under their eyes and the dark circles.
Why are you looking at me?
I'm not. You look marvelous. Other people, I see that. But what can you do to fix that?
The bags are actually two things. One is sometimes you have a little bit of excess fat, but almost invariably you have a little bit of hollowing that's making the bags look worse. So the fat transfer alone or in conjunction with the removal of a little bit of fat can sort of sort out that problem in a very dramatic way.
How long does that fat last once it's injected into your face?
That's a great question. That's the beauty of fat transfer, in that it's your body, so it's part of yourself, and the way it's injected in tiny little small portions of it, that fat will actually persist forever. Not the entire volume of the fat that's transferred, but a portion of it, say 50 to 60% of it, is yours forever, and that's what makes it such an appealing technique.
Let's talk about the unknown here. How many men get this done?
Actually, men are one of in terms of populations, one of the highest growing rates of populations for having these type of procedures, believe it or not.
On an average week, how many guys would come by?
Probably on an average week, 1 or 2.
Really?
Yeah.
And what do they choose? What do they have done?
Usually eye work and neck work. A lot of them have the area of the neck where it starts to get a little bit of fullness and some of this area, so a little bit of liposuction, a little bit of eyelid surgery, and those are all very quick procedures to get people back in looking good quickly.
Yeah. Yeah, you're an equal opportunity fixer. Dr. Karen, thank you.
Thank you very much for having me. I
coming by.
appreciate it.
So these
Thank you.
interesting, quick
You can go and get his and her. You can get his and her fixes.
That's
Can
right.
you give us a deal?